in.
Washing my hands. Hi, Mr. Hoffman. How are you?
Doing well, thank
Do
you.
you remember me?
Yes, I do. Yes, I do.
I'm Nancy I'm a nurse from Harper College.
Oh, yes, I've heard of you.
Okay, so today what I'd like to do is an assessment of your eyes, ears, nose, throat, and mouth.
Very good, let's do it.
Okay, so I'm going to start with two questions. One, I see that you're wearing eyeglasses. Do you have problems with distance vision or with near vision?
I have problems with near vision.
With near vision, but you can see distance fine without your glasses.
I have problems with both. I need
With
glasses.
both. So you're wearing bifocals?
I am wearing bifocals.
Okay, all right. And any problems with your mouth or throat, like frequent sore throats, or
No?
did you ever have your tonsils taken out?
No.
You still have your tonsils?
Yes, I
Okay, all right. So we're going to start by doing a visual acuity test. That means we're going to check your distance vision by using what's called the Snellen eye chart. So I'm going to have you step over here. Okay, so you are positioned 20 feet from the Snellen eye chart. So cover your left eye. And then on the Snellen chart, I'd like you to read the smallest line that you can read.
Let's go with line number 6. E, D, F, C, Z, P.
Okay, and then can you try line number 7?
F, E, I, O, P, Z, D.
Okay, good. So now cover your right eye. And then read the smallest line you can read.
I think that's going to be line number 8.
Okay? Go ahead.
D, B, F, P, O, Z, E, O.
Okay, and then can you read line number 7?
F, E, L, O, P, Z, D.
Okay, good, thank you. Okay, so with the right eye, you were able to read line number 7. You only missed one letter, so you really were able to read most of that. So your vision in your right eye is 20, 25. And what that means is that at 20 feet, you are reading what the normal eye can read at 25 feet. Then with your left eye, you tried line number 8, but you missed about 3 letters with that one. So you really couldn't read line number 8. You were able to read line number 7. And so with your left eye, again, your vision is 20, 25. That means that you are reading at 20 feet what the normal eye can read at 25 feet. Okay, and that is using the Snellen eye chart. All right, thank you. Let's come have a seat on the exam table. Okay, so we're going to continue the examination of the eyes. Can you look up a little bit? Just your eyes, look up. All right, I'm looking at the conjunctiva. It should be moist and pink, which it is, and I'm looking at the sclera, which is china white and moist. I'm looking at the symmetry of the eyebrows and the eyelids, and I'm noticing that the space between the upper lid and the lower lid is symmetrical on both sides. So I see that the eyes are symmetrical. And then I am going to have you follow this pen with your eyes keeping your head still. And I'm going to have the pen move into the cardinal positions of gaze, the 6 cardinal positions of gaze. So just follow with your eyes. The eyes should move symmetrically. Follow the pen. So conjugate movement, meaning the eyes are moving together nice and smoothly, is normal. And then I'm going to move this towards your nose. Just follow it in. Follow it in, follow it in. Okay, good. Let's try that again. I want you to keep your eyes on this, both eyes. Okay, good. So, and that is testing cranial nerves number 3, 4, and 6. Looking at the extraocular movements, or sometimes you hear it abbreviated EOM, extraocular movements. Now I'm also going to look at the pupils of the eyes, so look straight at me. And I'm going to shine a light into the pupil. Okay, and I see that the pupil responds by constricting, and the other pupil responds by constricting. And I also am looking at the pupils at rest. They are equal in size and round, and the irises are brown and equal and round. And the pupil responses I would document as perla, P-E-R-R-L-A. The pupils are equal, round, and reactive to light and accommodation. Okay, so that's everything with the eyes. Then we're going to move on to the ears. We are going to be just looking at the ears. The ears are symmetrical. They're in the correct location on the head. If I was to draw an imaginary line from here out to here, the pinna should be there. It should not be below there. And I'm going to palpate the ears. I'm just touching your ears. Any pain?
No.
Or tenderness with that? And I'm looking at the skin. I'm looking behind the ears. Sometimes our patients in the hospital, they get pressure sores from wearing oxygen here, so it's a good place to make sure that you look and assess. And then I'm going to assess cranial nerve number 8. That is your hearing. And I'm going to whisper something in your ear, and then I'm going to have you repeat it to me.
White shirt. White socks.
And you're a fan of the White Sox?
Fan of the Cubs. The color of your shirt jacket here.
Okay. All right, so that means that cranial nerve, the acoustic nerve is intact. And then I'm going to assess the nose. I first see that the nose is fairly symmetrical. In your book, it describes the nose as a triangular shaped organ that is on the front of the face. I think that's an interesting explanation of the nose. I am going to palpate. Any pain with that? Tenderness?
No.
All right. And I'm going to look at the septum. It looks like your septum is in the center where it's supposed to be. I see each of the nares is equal. Can you plug one of the nares and breathe in and out? Any trouble breathing? And the other side? Any trouble breathing? Okay, so both nares are patent. Okay, so that's all for the nose. And then moving on to the mouth. All right, so first with the mouth, I'm going to look at the lips. And I see that his lips are pink and moist. I don't see any lesions or cracking on the lips. And then I'm going to look inside the mouth, if you can open. I first am looking at the teeth. His teeth are white. I do not see any missing teeth. I see the gums are pink and they look tight around the teeth. I don't see any gum disease or inflammation or redness. I notice there's some fillings on the teeth, but I do not see any missing teeth or malpositioned teeth or teeth that are rotten. And then I'm going to look inside. I'm looking at the inside of the cheeks. That's the buccal mucosa on each side. Okay, it should be pink and shiny with no lesions. I'm looking at the tongue. Can you stick your tongue out? So there's the ventral surface of the tongue. It's pink and rough. Can you lift your tongue up? And I look at the dorsal part of the tongue. It's pink and shiny, and I see the veins there. And I look right down here into the bottom of the mouth, and that's pink and shiny as well. And then I look at the back. Okay, I'm just going to touch your tongue here. Don't put the depressor too far back in the tongue. You'll gag the person. So I look all the way to the back at the uvula. It's pink. I look at the tonsils. They're not enlarged. I look at the back of the throat. So the last thing I'm going to check in the mouth is for you to say, ah. And I see that the uvula and the soft palate rise, and that is testing cranial nerves number 9 and 10, and they are intact. That concludes the assessment.